It has another characteristic, that it comes and it goes, it relapses and it remits, not unlike multiple sclerosis. Does anyone blame with anger and disgust the person with multiple sclerosis who, after getting out of a wheelchair and having a productive life, succumbs to a relapse? No. We muster up our empathy. We want to help them and nurture them back to health. Not so for the stigmatized alcoholic or addict. A relapse is seen as a moral failing, a lack of character. The disease of alcoholism and addiction is a disease of a portion of the brain that by its very nature gave alcoholics and addicts a very bad name. An area in the brain stem, the midbrain, that's called the reward center. But we all know alcoholics and addicts that say that their pleasure or their reward from drinking and using has stopped long ago. That they're required to use just to try or attempt to feel normal. Not high, not euphoric, just normal. Just to stop the withdrawal, to stop the pain. The deciding area of the brain, the upper portion of the brain, the cerebrum, is where concepts like morals and values reside. As you may see in the red arrows in our diagram, this portion is somewhat disconnected from the midbrain. For our sake, let us now call the midbrain what it actually is: the survival brain. The survival brain is a portion of the brain also known as the reptilian brain. It's the only brain that snakes have. 200 million years ago, God said to snakes, I've only given you this little bit of a brain. We'd like to see you survive into the year 2010 with your little tiny snake brain. I better equip this with everything that's required. Some guy named Gucci has big plans for you. So snakes went on their way to survive 200 million years with a brain that told them exactly what to do. Move away from danger and toward food. Eat for your nourishment and drink. We'll conveniently place another little hole at the other end to get rid of what you eat and you drink. And finally, and my own personal favorite, procreate. It's fun. Well, why would a snake want to do that over and over again for 200 million years? Well, the Divine One thought that the best way to do that would be reward the snake for behaviors that are going to perpetuate survival. You get rewarded on a hot day when you drink a cold lemonade. It feels good because of something called dopamine. You get rewarded when you procreate. Orgasm feels pretty good. You get rewarded when you're hungry and you satisfy your hunger with food. Each time, this is the action of the drug dopamine in the midbrain. Now imagine if you were the divine creator and decided that you're going to invent a disease called addiction and wanted it to be particularly difficult to treat. We're going to plague mankind with this disease. It's going to be around for years and years and years. It's going to be very difficult to treat. I would not have that disease use a section of the brain that allows you to decide whether or not you're going to have it. That would be the upper brain, the brain I used to make my choice to steal a watch a while ago. No, wouldn't it be better to go after that portion of the brain where there's no choice? You have no choice to stop your heart from beating right now. You have no choice to take your next breath. You have no choice to change your kidney filtration at this moment. That's all automatic. All animals have these automatic functions. Indeed, if you had to think about your next heartbeat all the time, there'd be little else you could think about. God knew in His infinite wisdom that this disease could hijack our survival brain, where a drug of choice for someone who is genetically susceptible to the disease of addiction takes on as much importance as food, sex, water, and even the air we breathe. The brain is hijacked by the drug of choice. The midbrain is concerned with the next 30 seconds. The upper brain is concerned with past, present, and future events. Will my kids go to college? They are going to college. I have to go to their graduation. The midbrain is concerned with, what the hell am I going to do in the next 30 seconds to survive? I'll give you this. It's a disease that starts with a choice. Certainly, we've all had the choices to smoke this or drink that or try this, usually at the age of 13, 14, 15, or 16. But only a certain number of us have the genetics that will be throwing a switch at that first exposure and taking us down the pathway toward addiction. Maybe not manifested as a teenager, maybe not in the 20s. It might even stay at bay until retirement before it rears its ugly head. But as our beloved Dr. James West says, a metaphorical switch has been thrown. You see...